Hello, everyone, and welcome to today's webinar. My name is Bianca. I'm a team member here at Inspira Advantage, where we are dedicated to helping you get into your dream medical school. Today's webinar is going to be a medical school experience Q&A. So it's a bit of a different format than we're usually used to. We have our two lovely panelists here with us, Callie and Chiamaka. Would you guys like to introduce yourselves before we get started?
Hi there, I'm Callie. I went to the University of Iowa for undergrad and I'm now a fourth-year medical student at Yale, and I applied into psychiatry for residency.
Hi everyone, my name is Chiamaka, better known as Amaka, and I go to med school at Dartmouth. I took a research year, so I'm basically an extra year. I had an extra year to go through med school, completing my research year in April, and I will be applying into dermatology.
Amazing. Thank you guys for being here with us. All right, so today's webinar is more of an open forum Q&A. So if you see on your screen, there is a Q&A box that you can type your questions into. So while we wait for those questions to come in, I think we'll get started kind of just asking our panelists what your experience has been like, or any kind of stories you might want to share to prime our discussion for today.
Yeah, so I guess just to paint like a broad picture of what to expect from med school, it's definitely a lot, but it's doable. Like once you get there, like there are pretty like overall clear expectations of what you need to be doing. And so it's just a matter of like a lot of time management and like a little bit of like self-directed learning, a decent amount of self-directed learning. And yeah, like it's doable. It's not like you have to give up every other single thing in your life and med student is the only thing. Do some people do that? Yes, but like you don't have to if you're good at time management, for sure.
I was second what Callie just said. I actually have a picture of my first day in med school, and it cracks me up every single time because I was so serious. I had this button-up shirt and I had, it's like, oh my God, finally med school is serious. And I quickly realized that, yes, there is a lot of material, but you are there to form friendships. You are there to network. You are there to figure your life out, because most of you might be like me. I came into med school and I knew I wanted to be a doctor, but I didn't know what I wanted to do in medicine. I knew I wanted to have friends. I knew I wanted to be able to travel, but then I didn't know how to figure out how that would look like in terms of career choices. And I think, yes, when I look back, almost fourth year now, basically a fourth year, looking back at my first year, you do learn a lot. It is a lot of self-directed learning. A lot of the times you are learning as a community outside of even your school, because you will hear of Anki, you're going to hear of everyone using Boards and Beyond, everyone sharing resources. So it became this huge community for me where we had a shared language. Even if, yes, I'm here to learn, I also found community. I found time to travel. I found time to date. I found time to do everything else outside of my medical interest.
Yeah.
Thank you guys so much for sharing. I feel like every single time I hear about med school, it's this huge, terrifying thing. And I feel like everyone seems to have that preconception.
It's hard, but like people manage. It's not like only half the people make it through or anything like that. Like you make it through.
Amazing. Okay, so I guess that would be a great segue to going into our first question. Someone asks, what is medical school like? Pretty broad, a lot of room to move there.
I mean, the way the preclinical years are always talked about, it's drinking water out of a fire hydrant or a fire hose, because there's just like so much information coming at you, and you're just like kind of feeling a little overwhelmed because you're not going to quite be able to know all of it. But the thing is, you don't have to know everything all the way perfectly. Like, you start to learn how to, like, it's not like undergrad where you have a course or a textbook and you can just like learn everything in that material and then you're like done. There's infinite knowledge to be learning here. And so it's a lot more about prioritizing like what's higher yield, what's lower yield, and learning things at a level that's comfortable to you. So that's like how I would describe the preclinical years. Clerkship years are it's self-directed in the way of like learning how to be useful and like how to put yourself into good learning experiences and how to like help your team and help your patients, which takes initiative in kind of like a different way than like building your own study schedule. And then the last like back half of med school is even more self-directed with kind of, applying to residency and which electives and sub-internships and away rotations you're doing. So it's a little bit more it gets progressively more like create your own adventure as you go along.
This will not be a med school conversation if we did not mention high yield, low yield. Just know it's very important to us what's high yield or low yield so we can use our time and allocate our resources appropriately.
All right, so leaning into that a bit more, what can someone expect during each year of medical school? What are the courses like? What's the coursework like?
So I can take that one. So normally there's 4 years of medical school, and I'm going to add the nuances you're going to find within those 4 years of med school. I think a lot of schools are going towards the system-based way of learning medicine, as opposed to before it was more, you start with something like anatomy, you go through physiology, you go through histology, and you're learning these buckets. Now, the first 2 years of med school, and we call it 2 years, but I think a lot of schools are going towards a 1.5 year of med school, preclinical side of med school. And preclinical side of med school just means preclinical, like when you're in the classroom, sitting down and learning and figuring out the pathophysiology meaning the way the cells work, the way the molecules interact with people, not the big picture, the very minute picture. And you're just learning that medical language. You're learning the science language. You go through courses like cardiology, neurology, psychiatry, respiratory, infectious disease, or immunology. You're going dermatology, MSK, which is musculoskeletal, endocrinology. So they do teach you everything you see in med school or medicine. They do teach you all those systems in the first 1.5 to 2 years of med school. Somewhere in between your first year and second year, most people have a summer where they can do research in that summer. And after your second year of med school, or that 1.5, which is the very end of your preclinical year, what marks the end of your preclinical year is something we call step 1, which is the first board exam you're going to take. And that first board exam covers all those topics, all those preclinical topics you've learned. And then after you've done that, you've synthesized all that knowledge you've had, then you go into third year, which is when you go into the clinical learning environment. Every school usually has this standardized. Your third year is when you're doing your core clerkships. I remember clerkships. That was the first time I heard about it. Clerkships is just a fancy way of saying that this is a clinical field that you're going to be focusing on at this particular time. So the core clerkships include OBGYN, psychiatry, surgery, internal medicine, family medicine, and I'm missing one.
Neurology.
And neurology, pediatrics. So you have this core clerkships that everyone in the country, regardless of what med school you go to, you basically have to do that. And then somewhere in your third year, you might have an elective block. That's where you start to basically look at the things you might be interested in. Like I did my elective in dermatology. I'm sure Callie did hers in psychiatry. Or if you're considering something like ophthalmology or orthopedics, anything outside your core, you can start to really go into that and see if you like that. And this is where the nuance comes in. Between your third and fourth year, you can make several decisions. Some people decide to pursue an MBA during that break between your third and fourth year. Some people decide to get an MPH. Some people actually go back to engineering school if there's something they want to do with medicine and engineering. Someone like me, if you're going to a field, quote unquote, competitive fields, or if you just really care about academia and you want to do certain types of research, some people do take an extra year between your third and fourth year to do that. So that can elongate that. Also, you might have a family, you might have life happen to you, you might just need a break. There are other ways where people go into a split year. So instead of going through third and fourth year in 2 years, they would go through third and fourth year in 3 years. So there are different options that come in during your third year. And then your fourth year is the exciting year. By then you're like, okay, I am a psychiatrist, or I'm a dermatologist, or I'm this person. And that's where you start doing a sub internship. You're basically auditioning for a role, for a sit at the table. And then you hear things like away rotations happen during your fourth year. Away rotation just means that if you go to school at Yale, but you want to check out what Boston is like, you can go to Boston for a month. If you want to see what Callie looks like, you can go to Callie for a year. If you want to be like, hey, I really love you, Houston, please accept me to be a resident, you can go to Houston for a month and show them that you're the kind of candidate they want. So that's basically a summary of all 4 years of med school.
Yeah, really well put. I'll get like a little bit more granular in like a few of the places here. I think that part of it also is that when the board exams happen, kind of depend on your school. So like I didn't take step 1 until after my clerkship year. I took step 1 and 2 back to back with each other. Pros and cons to that for sure. I think another thing, kind of getting into what the day-to-day looks like when you're on clerkships or rotations, is that it depends, if you're inpatient or outpatient, like if you're in the hospital or in a clinic. But I'll talk about when you're in a hospital because that's where most of your time is spent. Like you usually get there, depending on the service, like roughly 6:30. If it's surgery, it's earlier. It's psychiatry, it's later. And you like figure out what's going on with the patients. You come up with like, you go talk to them in the morning, do this thing called pre-rounding where you like say hi to all your patients and come up with what you think the plan is for the day. Then there's rounds where you meet with the whole team and like you go patient by patient and present what you think that you should do. And then you get told what we actually should do. Sometimes as you go farther along, you start to become more confident in your plans and be able to really help direct the course of care for the patients. But at the beginning of your head, it's like you're kind of not guessing, but like but you build confidence throughout the year. And then after that, you like as a med student, you kind of work up to this of like putting in all the orders for your patients, calling all the consults, updating the families, updating the patients. If are there any procedures that need done, like things like you do all of that. You don't start off doing all of that, but like by the time you're a sub intern, that's definitely the level that you should be operating at. And yeah, so you're like basically like play acting as a resident, but then everyone has to like double check everything that you're doing by the end. So just to give you an idea of like what it looks like in the hospital.
And just to summarize, I know that obviously I don't have family medicine, so medicine is very new to me. But the first 2 years you're in the classroom, the last 2 years you're in clinic or in the hospital. If you put them in those buckets, it would make sense.
Oh my goodness. That's a lot, but it really seems like a choose your own adventure.
It really is.
Yeah.
Yeah, I also took a research year between third and fourth year. And so that really got a lot more choose your own adventure time. And a lot of times just like explore hobbies and travel and like do research for sure, but also just like kind of take like a breather for a little bit.
Absolutely. It's nice that you get that break too.
Yeah.
All
You
right.
don't have to steamroll and just, there are options in case everyone says med school is overwhelming and they know that, and they don't penalize you if you need a breather.
All right. So we're going to move on to our next question. The question is, what is the difference between med school and uni? But I think we've covered those differences. I guess, what were the main adjustments, do you think, that you guys had to go through, or you see many of your students go through as they shift from university into medical school?
Yeah, I think part of it, I kind of mentioned this a little bit earlier, was that you're used to having like a syllabus with like, this is the chunk of information you need to know for this like class in undergrad. And then like, this is the book that goes along with it. And then you get to med school and it's like, oh, there's a ton of books I could read. There's a ton, no one actually reads books anymore. For the most part, we watch videos and do flashcards. There are books there, but like it's faster to watch videos basically. And you start learning how to prioritize what are faster and more efficient ways of learning. But regardless, is that you have a bunch of third-party resources, and then you have a bunch of resources from your school, and it's up to you to figure out which ones of those work for you and creating a study schedule that works for you, because you can't use all of them. There is not enough time in a week to parse that all out. And so you start to be able to figure out what plan works for you. So it's a little bit more like learning how to study a bit more and learning how to retain information over longer periods of time, because it all circles back together. So it's not like in undergrad where you're done with the semester and then you never have to think of that class again. Like this stuff keeps circling back. And so, yeah, flashcards over long periods of time are typically how people go about retaining information.
Yeah, I would say that was the biggest difference for me. In uni, you have this information, you don't have to remember it after. You can learn very granular details about the information they give you, while in med school, everything's longitudinal. If you miss learning about endo this week and you're just like, I don't care about endo, guess what? It's coming back. So there's always, and you have to you might not even know when it's going to come back. They might ask you something in the hospital that you learned your first week in med school. So everything builds on each other compared to in university where everything's more granular, everything's more discrete. This is more of whatever you're going to start learning, you're going to have to keep learning that so you subspecialize and you can remove the rest of it, but it's the lifelong learning process.
Wow. Okay. Thank you guys so much. I'm learning a lot, and I'm not an aspiring med school student. All right. Our next question is, how do you achieve a work-life balance in medical school? I think this is a good one.
Yeah, I think part of it comes down to you have, I'm going to say this over and over again, but time management. And I think it's important to make the time that you're studying be time that you're actually studying, and then the times that you're having fun be times that you're actually relaxing or having fun, and not getting into this cycle of I'm kind of half watching Netflix, half watching this lecture, kind of doing both at the same time, but not really focusing on either. It will never end if you do that. It's much more efficient to be I'm going to accomplish this much today, and when I'm done with that much, now I'm closing my laptop and going hanging out with my friends. Lock yourself out of your, I have an app called Forest that you lock your phone, locks itself out and grows a little tree to track how many hours you study a day. And that's really helpful because if you're just sitting on your phone while you're supposed to be studying, you're not relaxing and you're not learning. So what are you doing? So it's really important to have very clear lines between when you're working and when you're relaxing.
I totally agree. And I would say the really good students I know treat med school like a 9 to 5. And I am not one of them, because I would not treat this as a 9 to 5. I'm one of those people that I would play here, I would work here, I would play here. But I would say the people I know who had very strict schedules, like I need to be done studying by 5 and I go home to my family or I make dinner at this time. I feel like that was a better way to go through med school. It's always going to be impossible because you get distractions and you don't get distractions, but treating it like a 9 to 5 really helps. I would also say, like, you do get time off in med school more than people allude to. I feel like I've had a reasonable amount of time, and I've had time for friends, I've had time for family. You have breaks here and there, a good amount where you can travel and have fun and have time for your hobbies and still have good grades and still be a good student. You really don't lose yourself as much as it might be portrayed that you would.
Mm-hmm.
Thank you guys for that. All right, our next question is, what steps would one take to figure out what they want to specialize in med school?
Yeah, so I think that at the end of the day, your clerkships really teach you a lot. Like, one of the first decisions you're going to make is, do I want to do medicine or surgery? Like, surgery, not surgery. And then if you can't decide, there are some specialties that combine both of them. But I think that you start to get a sense, like, do I want to do inpatient? Do I want to do outpatient? Do I, like, you start like kind of narrowing things down, and like process of elimination can be really helpful too, in terms of, like, you know, and like what kind of lifestyle you want too is also like a really important factor that I feel like people think it's like taboo to talk about, but it's important. Like, your life as like a dermatologist is going to look very different than your life as a neurosurgeon in terms of like, not like beyond like residency and beyond for the rest of your career. Is like, what is it that you want to prioritize? And so lifestyle is definitely a consideration, but I think, yeah, in your core clerkships, really saying, like, could I see myself doing this? And could I see myself doing the bread and butter? Because every specialty has like really cool, interesting things that they see every so often. And then they have what they see like 80% of the time. You have to be okay with what you see the 80% of the time. Like, if you can't stand well child checks, don't become a like general pediatrician, because you're going to be doing a lot of those, things like that. If you don't like diabetes, don't become an endocrinologist. Like really pay attention to the bread and butter of it. And I think that also there's, you know, there are extra opportunities to like shadow. But I think more important, shadowing, I feel like doesn't teach you as much as doing a rotation where you're actually doing things. Like, shadowing is so passive. So I think doing extra rotations, like doing sub-internship, like I did sub-internships both in psychiatry and in internal medicine, just to be like really confident in my decision between the two fields. And so, yeah, doing extra rotations, I think, is, if you're on the fence, you know, at the end of your clerkship year, that's the best way to get your answer to your question.
I second everything you said. That was exactly how I went about it, choosing my specialty.
All right, I think, are we ready to move on to the next one?
I'll just add that, like, you have time. Like, you don't need to, no one, very, very, very few people walk into med school and know what specialty they're going into. It really isn't until later on that you really need to know for sure, unless you're doing like some, you know, specific subspecialties that require a lot of research. But in that, if that's the case, you can always take a research year. So like research like in that specialty specifically. And so, yeah, I wouldn't put a ton of pressure on yourself, especially when you're at this stage, to like worry about a specialty.
I would also add something that you learn as you go, because pre-meds are personalities. Med students, anyone in medicine tends to be more neurotic. You will worry about this. It's inevitable, but it really isn't as big a deal in the grand scheme, because guess what? Even after you match into a specialty and you're a resident and you're training, you can always make a switch. People make a switch from internal medicine to dermatology as second years. People go from plastic surgery to psychiatry, even after training. So no one's going to be like, oh my God, why would you waste our resources? You're already trained. There's no going back. There's always, this is your career and it's your life. There's always, even if it might be later on, you can always make a switch whenever you feel like your heart isn't in it.
A lot of things can change, I guess, over time. I'm wondering, just a personal question from me. Did you guys going into med school have an idea of what specialty you wanted to be in? No, it was just like, we're just going to med school and we're going to do the thing.
I had like an idea of what specialties I would want, and I did not end up in any of those specialties. But I think a lot of people come in with this idea that they want to do this specialty. And I always encourage first years and second years, if you feel like you might be interested in a competitive specialty, it is good to start knowing that department and doing research in that department, but you're not locked into that. You might end up, again, everyone comes in. I know a lot of people who come in as ortho bros, and then guess what? They go into ortho during their third year and they just absolutely do not like it. So it's always good to come in with an idea just so you can start networking, having research, but you're not going to pay. You absolutely cannot pay. My research was in urology, my first 2 years of med school. And then I ended up reciting surgery was just definitely not something I wanted to do. So people come in with ideas. You would hear the first year, everyone thinks they're going to do everything else. And then it's always interesting to see where they end up in fourth year.
Yeah, like I came in thinking maybe neurology or maybe OB-GYN, which seemed very different. But if you think, at least my perspective is that psychiatry had what I liked out of both of these, especially because I'm going to be probably doing women's mental health. But yeah, like I think another thing that is helpful is like people always say you choose your specialty based on where you find your people. Like each like specialty has its own personalities, and you start to like figure out who you vibe with, for like lack of another way to describe this. Like I sometimes joke like, yeah, I chose psychiatry because I think that's the field where I'll make the best friends, but like that's not even that much of a joke. Like you start, like each like specialty has such a different culture, and you want to work with like in a place where you'll be happy, and like because you'll start to like become part of that culture when you're in it, regardless of what you do. So you want to choose a specialty that will help you, become the person and the physician that you want to be.
And mentorship really can drive your interest sometimes. You might end up working with an amazing cardiothoracic surgeon that you're just like, I would love a career like that. Or you have someone in your preclinical years that imprinted on you based on they taught respiratory, and you just were like, maybe I'll come shadow you for a day, and then they give you a project, and before you know it, you're out here trying to get into internal medicine. So mentorship can really help. So find those mentors when you come into med school and see if you jive well with people. But it always changes. So don't put too much stock on that.
Thank you. So I'm gonna ask a question that I wasn't gonna ask next, but I think it just flows in seamlessly to what you're saying in terms of having a mentor and networking in medical school and finding people to inspire you. From your experience and kind of what you've seen with your students, what kinds of opportunities do you get in med school in terms of networking, gaining work experiences, mentorships, and how?
Yeah, so like kind of, oh, sorry, you can go.
Go ahead.
So sort of similar to undergrad, there are a lot of extracurriculars that you can be a part of. And that you'll notice that like some of the people are involved in a ton of extracurriculars, and some people are involved in like very few extracurriculars. And it's fine. Like do what you're passionate about, and that it will lead you to the specialty and the career that you want. Don't feel like you need to like do all these clubs just to like do them if you want to do them. And through those, you can make a lot of really good professional connections, like with faculty, with upper year med students, like people who can really be important advocates for you and mentors for you. I think also research is the most important thing that you will do outside of medical school, like the core part of med school, in for most specialties, or if you want to do academics or get into like competitive residency programs. So research is really important, and that, like, yeah, pretty for a lot of different, like for most different things that you're going to be doing, and it definitely doesn't hurt what you're going to be doing. And there's also like fun socials in med school. There's like, I don't know, ours is called like Club Med, and like every so often have that, and like socials like inner grad school like socials, and like different affinity groups, and like I go to like a bi-weekly dinner for one affinity group, like, you know, every other week. And like there is definitely like structured social things going on at med school as well.
And in terms of networking, one of the things you're going to find out is that once you're a med student, you're officially a part of an interesting club where people will respond to your emails, which is like, no one responded to my emails, but now there's the MED, and then you get a ton of response. So when it comes to networking, I always tell people cold emailing is fine and welcome. So if there is someone you wanted to work with, there is an interesting topic you wanted, there was something you saw online, cold email, and they will get back to you. If they don't get back to you, send them an email again. It just meant like they didn't see it. And if they don't get back to you, then move on. But you're more likely, the response rate would be triple the response rate as a pre-med, if not even quadruple. So that's a good way to network. A good way I found I network too is through conferences. I think a lot of schools have funding for conferences. So I get funded for 2 conferences a year if I want to go to, one for diversity and inclusion and one for whichever I want to go. If you have like, if you can also find funding outside of those school, the science student conference funding. So that's a really good one. You can go and see what's happening in your field. I love the dermatology conference. I go every year. There's one, neurology has a great one. They have one in Boston, and theirs is always fun. OB had one too. So there's always funding. AMEC, the student body, has a conference every year. I love to go to those and talk to other students. So that's really a good one. Gaining work experience. My experience is that a lot of med schools it's not really advice for you to work as a med student because you are so busy. And like, yes, you might think these extracurriculars and research and all these other things is in work, but those things take up so much of your time, and then your mental health and your well-being and family and friends and rest. And so most times, even if you don't have family members who are funding your education, I think most people have scholarships, loans that cover your living expense. So it's not, I would say most people don't work in med school. And if you're working in med school, you're a tutor, or you're getting paid through a research grant, or it's something that has to do with teaching, learning, academia, not that you're working. I had a classmate who was working delivering things for Domino's, and it did get overwhelming for him. It's doable, especially when you have chunks of time in 4th year. I have a classmate who is doing Uber. So it really does depend. You have to like be truthful to yourself about if your work is affecting your, basically like your academics. So just know like that's not something that is pushed by any med school, except you look for that. Obviously, right now we are counselors for Inspira. I do have other things, but you're not time-consuming things.
Mm-hmm. Yeah, very much agreed. And like, if you think about it, like the investment that you're making in med school, like the amount that you're going to be able to change that, like doing DoorDash or whatever, is like a drop in the bucket, like compared to how much it will take a toll on your ability to like both like keep up with your coursework and everything, but also just like be a person, and like you're going to have a stable financial career afterwards where you will be able to pay off your student loans. And so I really, like things like tutoring or consulting or like things like that you can like really make your own schedule and have it not be like, oh, you like 15 hours a week is too much for someone to be working in med school for unless perhaps a fourth year. But yeah, so I would not prioritize working right now. You have the rest of your life to work.
Amazing. Okay, thank you guys so much for that. Our next question is going to be, how challenging is med school? And I'm going to add to that and ask what, in your opinion, is the most challenging part of med school?
I think something that does get talked about a certain amount, but I feel like still not enough, is imposter syndrome. Dealing with that during med school is really hard. Thinking like, am I actually good enough to be here? Am I actually qualified to be a doctor? Do I know as much as my classmates do? Like, there's a lot of self-doubt. Talking to patients and like no one believes that you're actually there to be a doctor because they all think that you're like a nurse or a tech or something. And it like gets to you after a while. I think it's like really tricky. But like you're here because you were chosen to be here and you worked really hard to get here and you deserve to be here. And like reminding yourself of that and reminding that like everyone feels this way too. Like it is normal. Like if you have no doubts and you just think you're like God's gift to mankind, like that might be concerning. It's normal and healthy to like be questioning this level of like honestly power that you get with becoming a physician. And that's something to be like skeptical of and something to be, reflecting on.
I would say like how challenging is med school is such an individual question. Unfortunately, it really is an individual question, because I would say some people, med school in general is as challenging as you make it, and sometimes it's school specific too, right? Like I would give anecdotal evidence of this. So there's certain med schools that require you to go to class every single day, and you have to have 100% attendance, and you have to wear a button-up shirt. And then on the opposite side, there are med schools where everything is optional and you can zoom in whenever you want and you can 2x your lectures and you don't even have to watch your lectures and you can come in with pajamas to class. I'm talking about my school, but they're different. I've heard of the opposite side where they're a lot more strict, and you might find that more challenging, or you might find a more laid back school more challenging. And then there's some people that they're just not good test takers. It was what it was. Like they had to do so much work to get their MCAT score to a certain point. And that doesn't mean you're not going to make an amazing physician. It just means that in med school, the clerkship grades and your step 1 and step 2 you might just need a little more time studying. You might be a little more stressed about your score. You might get to a point where a course is just so hard that you might have to remediate it. So that is a personal journey for you based on where you find yourself. If you have a supportive administration or not so supportive administration, if you have life happens to you and you get sick, or you have a family member get sick, you're not going to be going through med school in the same format as someone else that has no worries apart from just going through med school. So it really is an individual journey, but I would tell you the average med student doesn't find med school incredibly challenging. I would say most schools have a 90+% match rate. So it means that when you get into med school, you're going to become an MD, you're going to graduate with an MD, and you're going to at least go to a residency program that will make sure you're a practicing physician. At the very least, 90+% of people end up having that. So like, as long as you're not coming in with all these notions and you're coming in with an open mind, the average med student doesn't find it incredible. It's a challenge. That's what it is. But it's not a challenge that is impossible, except you have all those other circumstances coming.
Yeah.
Super well said. Thank you so much. All right. We got a few more questions left. I think I'm going to ask this one. We're going to do a little study tip break. So the question would be how to study in medical school. Given that it's pretty free form for the most part, it seems. I think it's more of asking you guys what some tips are that you would have to succeed.
I would start, and this is, I feel like Callie would please go into more detail. I'm going to give like my very brief. What I found is compared to when you're passively learning in undergrad, where you're just like, I'm going to just listen to this lecture, or I'm going to just skim through this book. And at some point when I really have to learn it, I'm going to learn it. You have so much information in med school that the time when you're learning something is when you have to learn that thing. You might never have any other time to go back to that subject. So you have to learn how to actively be present whenever you're learning something. Doesn't matter. I'm an audiovisual learner, like most med students I find, and we do love flashcards, but whenever you say like, I'm going to be learning repro today, you're learning repro today. You're not glancing through repro today, because you have just a week to learn repro. Sometimes you might have 2 weeks to learn that topic. You don't have time to just glance through it and then come back to it.
Yeah, no, very much so. And like, I think that, yeah, like when I mentioned earlier, like kind of tongue in cheek, no one reads textbooks. I don't mean that because people are lazy. I mean that because textbooks aren't active recall. They're even if you're like highlighting, that's still very passive. It's much more effective use of time to watch an overview video and then put that into practice by doing like practice questions and like being able to retain the information that you've learned doing flashcards that have like spaced repetition throughout all of med school, pretty much, or up until you take the boards at least. And so like I think that's like having that self-discipline to be like, I have my minimum like half hour of flashcards that I'm doing every single day, and I'm going to do those every single day for like 2 years. And you don't have to be that diligent with it. I certainly wasn't. I was kind of late to the game. But once like starting like a year before I took step one, I started like actually doing flashcards, and that was tremendously helpful and helped me like recall things I'd studied like a year previously, like as well as I needed to. When I learned it a year ago, I could still do it. So I think just being able to do like that little bit every day really is important. And again, you don't have to study for 12 hours a day every day. No one does that. Like that is not sustainable. But to be able to do like that, at least at the bare minimum, like a little bit to retain every day is critical.
Do you guys have anything else to add? Is that it?
It's a lot of trial and error, and it's so interesting. Like different courses call for different study strategies. You might find that you were able to just read through the psych course, but for neurosurgery, you have to draw things out to really like understand what the pathways are. So, or we have a course called Foundations, which is mostly like pathophysiology and learning how molecules interact with different things in your body. And you're just like, okay, I have to like understand like the death pathway or the whatever pathway. So different courses call for different things. You have to be adaptable whenever. You can't be like, okay, this worked for me in this course and now I can't change it. Even what works for you for step one might not work for you for step two. What works for you for this clerkship might not work for you for that clerkship. And there's so much information out there. There's so many books, so many different flashcards, so many different videos. You have to make sure you don't overwhelm yourself, and you have to pick the best resources and just stick to those resources. Even question banks, there's so many question banks. One question bank might have 5,000 questions. you might not have time to even go through one question bank. So if you're trying to go through all question banks, you're going to have to, you would overwhelm yourself. So it's also a skill to be able to decipher through all the noise and make your own schedule. And just because what works for your other classmate, you might see that you're doing Anki cards every day. And if you're doing Anki cards every day, that actually starts to affect your mental health. You don't have to do and follow what other people are doing. So I don't like that I keep repeating this, but it's really true. This is an individual journey. And the minute you start to do what other people are doing because they have success, that might end up not working for you and stressing you out.
Thank you guys.
Oh, sorry. It's hard to not compare yourself, but like truly do what works for you and not what works for other people.
Yeah.
Thank you guys so much for those insights on how to study in medical school. Okay, the next question, which might be a little bit broad. What factors should you consider when choosing a medical school?
Yeah, I think there's a lot of things to consider. And if you're in the position where you have multiple acceptances, that's a good position to be in, and very lucky to be able to making that decision. I think that what can sometimes get overlooked, but is honestly still important, is like which one's going to be cheapest for you, like which one has best financial aid. Like that matters a lot, like really. And like some schools will let you like kind of leverage your financial aid for other like scholarships for other places. Some schools have policies where they don't do that. Some schools have like extra scholarships. Like it all totally depends. I like after you get accepted and like finding that out. But like for me, it was like cheaper to go to Yale than it was to go to University of Iowa because they had way better financial aid, and like that's not so atypical. And so that's one thing that I pay attention to, the finances. I think also whether or not it's like kind of you're mentioning earlier in the spectrum of like everything is required, there's tests every other week, like everything's in person and you're getting graded all the time, to like way on the other end. I think it's like the schools that we're at that like nothing's like everything's optional, we don't have any grades, everything's pass fail. Like our school doesn't even take shelf exams, like truly. Yeah, like yeah, like just like very like no class rank, no AOA, no honor societies, nothing. Like you're not competing against each other at all. And so like figuring out like where on that spectrum you want is really important. Because like it sounds like the one over here is like way chiller. In a lot of ways it is, but it also means that like you don't have any extrinsic motivate, like nothing is pushing you to study. Because if you like fail your test, you just kind of take it again and it's fine. And like there's no real, like you need to be holding yourself accountable to learn all of this, because like when it comes to the boards, those are actually scored and you need to do well on them. And so, and also like to learn this for the sake of knowing things to be a doctor is really good too. And so it takes a lot more personal accountability versus if you have like a test every other week that you're studying for, like that can be your, accountability. So figuring out like where on that spectrum works for you. And then also location is huge. Like if it's important to be by your family or a support network or a significant other or what have you, like apply to schools that are close to them and prioritize that. That being said, I completely up and started over knowing no one on the entire East Coast and it was fine. So, but yeah, just like location is a really important factor as well.
Yeah, I agree with that. Yeah, no, money in my mind. I feel like that should be number one. When you get all your acceptances, look at who gives you the most financial aid, because really the accrediting body in the United States for medical schools is so strict that if you're an MD, I can't really, obviously like the really ODO schools too, but if you're in a body and you're accredited, they accredit you based on certain things that every med school has to give your students. And at the end of the day, you're going to end up becoming a physician, regardless of if you go to Harvard, Yale, UCSF, Northwestern. it depends on what specialty you want to end up to, right? Like some people might end up going and becoming dermatologists regardless of what school they go to. Some people might end up going into internal medicine. So you just, once you're in med school, you make of it what you make of it, because step 1 is a standardized test across the board. Step 2 is a standardized test across the board. Clerkships, if you take them, are standardized across the board, where there are percentiles across the board. When you're applying into residency, yeah, where you go can affect what residency you go to, but also self-determination, because there's some people in whatever school you might imagine would be a top school that would still have problems matching too, because they're just not great students. So I would say that you want to go to a school that would not give you the most debt. Just, I know of a friend who went to a school who gave him the most debt, but he thought had more prestige. And it's an interesting choice to make, because you will have to pay off those debt and that money. And if you don't have to, I think it's something to really consider. Location is something to really consider. I would say class size too would be something. There's some med schools that have 300 people, and there's some med schools that have 90 people. So there's some med schools that have like 10. So it really depends. If you're someone that like you feel like you're not going to make friends in a small group and you need a large group of people, maybe you should consider a larger group of school. If you're someone who you want the administration to know every single one of you very closely, then you might want to go to a smaller school, smaller class size of school. So that's also something I remember I considered too. And location, definitely. Not just like where your family is, but also, do you want more urban city? Do you want more rural city? Do you want a city that has an airport, a major airport? Do you not care about that? Are you a skier or a snowboarder? Do you want to be around those sports? My significant other likes to, he would never live close to a place that doesn't have a body of water because he surfs. So it's like, are your hobbies, can you get those hobbies around you and not be unhappy if you don't have those hobbies around you? So thinking of all of that. But again, applying broadly is always good, and then looking at the choices after you get your acceptances. You can't make these decisions before you get your acceptances.
Yeah, for sure. And yeah, I think that it's not like law school where like the prestige really, really matters in terms of you being able to like have a career or even be able to pay off your loans or things like that. Like you got an MD, you're gonna be okay. Now, is it easier to match into like super competitive like plastic surgery coming from like a top school versus like a school that no one's heard of? Yes. No one's saying that it isn't. But like the point being is that it's still like the scales are like tilted a little bit, but like you still are going to be okay, like regardless of where you're at. And like what opportunities you seek out for yourself, and like the application that you create for yourself is really important too. And so yeah, like prestige matters somewhat more so if you want to do academics or a really competitive like surgical or subspecialty. But even then, like you can still make these things work coming from any med school.
Thank you guys so much. I think that's all we have time for today. This is such a great conversation. I feel like I've learned a lot, and I hope you, the audience, has learned a lot too. Thank you so much, Chiamaka and Callie, for being here and speaking with me about med school experience.